Good morning, everybody. In the 24 hours to last night, we had nearly 82,000 tests. Thank you. That is an outstanding result, and we need it to continue, especially until July 30. Please make sure that if you have the mild or you've been deemed to go and require a test, that you go and do so. In the 24 hours to 8 p.m. last night, we had 111 cases of community transmission. Unfortunately, 29 of those were infectious in the community, at least 29 of those. So as we see, that is the number which we need to get close to zero to be able to get out of the lockdown. And as we see, unfortunately, this number is stubborn and it won't go down. What we've seen during the last 3 weeks of the lockdown is that we have managed not to have the thousands of cases that would have resulted had we not gone into lockdown. So we've prevented the widespread of the virus. We've prevented thousands and thousands of people being exposed to the virus and getting infected. But what we haven't managed to do is really budge that stubborn number every day for the last few days where we need to quash this virus. It's not good enough for us to tread water, which is what we're doing now. We've to some extent stabilised it, but we're not managing to get that quash that curve, to get that curve to come down. We've certainly prevented thousands and thousands of cases, but we haven't managed to quash the curve. And that's why the New South Wales government is taking further action from today. We want to make sure we have a no regrets policy. We want to get out of this lockdown as soon as we can. We want individuals, families and businesses to bounce back as soon as we can. And that's why we've taken some very difficult decisions, as we said we would, to make sure we keep the community safe and to make sure we can quash this virus before we get out of the lockdown. Yesterday afternoon, we were presented with some additional data from New South Wales Health, and we will release that today in relation to exposure sites. Even though you may not to date have had cases in your community, the exposure sites and the number of them demonstrate that the exposure sites are all throughout Greater Sydney. So just because there hasn't been a case in your suburb or in your local government area, don't assume there isn't. What we don't have is that data for the last 5 days. There's always a gap between the cases that are exposed and the cases that may actually be in the community. And that's why we need to take that extra action today. I want to say again to the community, thank you for everything you've done to date. And there is no perfection during a pandemic. But what there is important decision making to make sure we prevent the virus from spreading and that we quash it before we can get out of the lockdown. Now, I especially want to thank the residents of southwestern Sydney who have been absolutely outstanding in relation to listening to our health advice. But unfortunately, the vast majority of cases, around 80% or higher, is still in those 3 local government areas. And we're seeing the cases not just in the Fairfield local government area, but also the exposure sites and the cases trickle into the Canterbury Bankstown Council area and also the Liverpool Council area. For that reason, what we'll be asking everybody to do in those local government areas is to stay in their community, in their local government area. You cannot leave for work in those local government areas until July 30 at least, unless you are a health or emergency services worker, and of course that includes aged care and disability care. But unless you're providing health or emergency services care, you can only work in your community in those exceptional circumstances. We don't want anyone in those 3 local government areas working outside those local government areas. Now, we please ask for all businesses across the Sydney metropolitan area and beyond to consider rostering arrangements over the weekend, to consider what they can do to mitigate the impact on their business. But it's so important for us not to have that concentration of cases spill out into the Greater Sydney community. So if you live in either the Fairfield, Canterbury, Bankstown or Liverpool local government areas, you cannot leave those local government areas for work unless you work in health or emergency services. And please make sure that happens from midnight tonight. We're also making sure that if you do need to leave those local government areas for work, if you are in the health or emergency services areas, that you get surveillance testing. That is, you are tested every 3 days, and we appreciate this captures who are randomly being tested in those communities where there's a high virus load are turning up positive, and Dr. Chant will provide an update on that. From midnight tonight, we will also make sure that only critical retail remains open. We have a list of what is critical retail, so obviously obvious things like supermarkets, pharmacists, they will retain face-to-face retail, but anything which is regarded as non-critical retail will not be able to have face-to-face. You'll either have to click and collect, you'll either have to get delivery or takeaway, but please know that we've considered carefully what is on that critical list, and that will be made available very shortly. Please note, we want no carpooling. Until July 30, no carpooling. Unfortunately, we know that when people outside of their household are coming into contact, they could unintentionally be spreading the virus and then spreading it onto others. So please, no matter where you are in Greater Sydney, I know it's really hard, no carpooling for anybody, because unfortunately, we don't know where the virus is lurking. We know where their exposure sites are, but we have a blind spot on the last few days, and we need to make sure that we cover that off. Now, the next decision was a difficult one, a very difficult one. But until July 30, until midnight on July 30, there will be a pause on all construction, large or small. Non-urgent repairs, any form of building, renovation, construction, maintenance, including cleaners into the home or workers into the home, will not be allowed for all of Greater Sydney until July 30. We know this is a big decision. We know the impact this will have on businesses small and large. But we really need to reduce mobility, and we need to reduce the chances of anybody getting the virus in their workplace, spreading it to work colleagues, and then bringing it home. And we know that there's a lot of work being done now to ensure safety around construction sites, large and small, and we thank the industry in advance for the work they're doing to be able to resume operations. But until July 30 midnight, we want to pause on all construction, all non-urgent maintenance, and of course, when there are urgent requirements for electricity or water or other repairs, of course that will occur. But for anything that's non-urgent, anything which can wait till after July 30, obviously there'll be a pause on all construction, small or large. We don't underestimate the impact this has on our businesses. We appreciate that. But what is really important for us is to give business every chance to bounce back. This is our chance to quash this virus and make sure that families and businesses can bounce back as quickly as possible. And our best chance of allowing that to happen is to put a pause on all those work sites between now and July 30. It is also really important for us to acknowledge that in addition to the measures we've put in place, there will be harsher penalties for any employer who forces their employee to come into the office. We've said that employees, anyone who works in an office environment should be working from home, but if your boss forces you to come into work in an office environment, your boss could be given an on-the-spot fine of $10,000. We don't want employees being forced into the office. We've said that all people who can work from home should be working from home, and if you feel you're being forced to go into the office, your employer will be given that harsh penalty. Please know that any time you're leaving the house, no matter where you live in Greater Metropolitan Sydney, you should have a mask with you. Even if you're just exercising with your household, you might change your mind to pick up a coffee or pick up something, or be in an outdoor market, you have to wear a mask in those settings. If you're coming into contact with other people, you must wear a mask and have social distancing. So please make sure that whenever you leave the home, you have a mask with you. You might not think you need one, you might think you're just going out for a walk with your household or with one other person, but in those instances, the health advice is please have a mask with you so that if there is any unintended interaction, you've got that safety mechanism with you. I also want to emphasise that all the settings in regional New South Wales remain the same. Thank you to regional New South Wales for the work you've done. You will not be having any additional restrictions imposed on you, but please know, keep up the good work, keep up what you're doing to make sure that you comply with the rules in place. Now, this is really a time for all of us to come together. I can't remember a time when our state has been challenged to such an extent. I can't remember a time when government has had to make these difficult decisions, and from a personal perspective, can I say that not a single one of these decisions was taken lightly. I've always said to our community that we'll always take the decisions to keep our community safe, and to allow businesses to bounce back as soon as possible. None of this is easy, and none of us would have made these decisions unless it was based on health advice and unless it gives us the best chance of quashing the virus in the shortest amount of time. We're already in lockdown, and we're asking our community to go that step further until July 30. I know that many people will be very angry and upset with me, with the government, but please know that we're making these decisions for no other reason than because they're the right decisions. We want to get out of this as quickly as possible. This Delta variant has been a challenge for every single nation on the planet. We are no different from that, but we have an opportunity to quash this. We have an opportunity to quash this and have a good existence, a normal life until we get a proportion of our population vaccinated. So the sooner we can impose these restrictions at this time, the sooner we can come together, follow the rules we've put in place, the sooner we can come out of this, have a good existence, a normal existence, until we get the vast majority of our population vaccinated. I want to thank everybody in advance. I know these decisions aren't easy. I know a lot of people will be upset, but as we speak, we're reaching out to community leaders, to business leaders, to make sure we consult and discuss these decisions, but also make sure we make the transition as quickly as we can. We are also applying and really calling on people for their common sense. We know that you can put things in health orders, you can ask people to do things, but we also rely on your common sense. There is no perfection in a pandemic. I know that people will try and pick out holes and say, what about this and what about that? Please know we're doing our best to provide as much black and white as we can, but it's not perfect, but it's the best chance we have to get out of this as soon as we can. I know the overwhelming majority of our citizens want to get out of lockdown as soon as we can, and that's why we've taken these difficult decisions. And I just want to thank everybody who supported the government in this time, and more than anything, I just want to really thank every individual, people living on their own, every single family, every single household, every single business who has taken one for the team, who's working hard so that all of us can be safe, and I can't thank you all enough for that. All of us have a part to play, all of us need to come together, and I just thank everybody in advance for your understanding and your patience. And please know that if more vulnerable people will be taken care of, people who are isolated will be taken care of, please know that in addition to these tough decisions we've taken, we have a compassionate approach during this time, and we'll make sure that anybody who needs is given that assistance. I'll now ask Dr. Chant to provide her health update, and then Deputy Commissioner Warboys to talk about the compliance and also the police support, especially in those 3 local government areas, in supporting through the emergency services networks our community during this difficult time.
Thank you, Premier. New South Wales recorded 111 locally acquired cases and 6 overseas acquired cases. A record of 81,970 tests done, and I think that is a real testament to both the community and also the healthcare providers who took those swabs, processed them, and the labs. So thank you so much. We need to see that testing level really push our capacity as we aim to identify any unrecognised chains of transmission. We have 1 death, and sadly a gentleman in his 80s in southeastern Sydney died yesterday, and again I extend my sincere sympathies to this family. As the Premier had said, stubbornly we are seeing 29 cases infectious in the community, and some for part of their infectious period. We are seeing some cases still diagnosed late, but we need to see that number get down. It is far too high, and that is the basis for why we've recommended much more extensive actions to reduce those interactions. Of the 111 locally acquired cases reported to 8 p.m. last night, 83 are from Southwestern Sydney Local Health District, with 60 from the Fairfield local government area. We are concerned about the spread into the Liverpool and the Canterbury Bankstown adjacent area. But can I just say, we will be providing, and on our website you can see the exposure venues. The exposure venues are where there's infectious cases that we know about. But remember, there is about a lag of a week, and so what you might be knowing is we might have unrecognised cases and other exposures. So I can't stress it enough. Every time you go out and about, please assume that you have come in contact with someone who is infectious. Also, I just want to call out some other areas for increased testing. Campbelltown, Camden, Lakemba, Fairfield, Liverpool, Bankstown, Cumberland, Mount Druitt, Rooty Hill, Bayside, the Sutherland Shire and the Georges River area are considered areas of concern, and I'm particularly concerned about Minto. We've had a sewage detection in Minto, which is in southwestern Sydney, but we haven't got a plausible case there, so it is really important that that community absolutely responds. We have currently 75 cases admitted to hospital with 18 people in intensive care, 6 of who require ventilation. The reason for our controls on further reducing spread into regional New South Wales is that our surveillance testing picked up and had a number of near misses in terms of detecting people that were just about to become in contact with people in rural regional areas. But as an example, we had 3 of today's cases are people who travelled to Molong in the state's central west on the 16th of July. And what happened is we found the results of their testing and called them when they were just about to conclude some of their business. Now, unfortunately, that those people had also worked in the northern New South Wales on the 15th, and we will be releasing any information that's relevant about that. We're just ascertaining some additional data, but it does highlight that all regional communities should be on alert. In relation to our other recommendation that I think wasn't touched on by the Premier, it's in relation to mask wearing. So just to say, in relation to mask wearing, we do want masks to be worn in all outdoor workplaces. And the reason for that is that people don't necessarily maintain the social distance. They're not conscious of their social distancing at all times. And I think I've described the fact that whenever you can't socially distance, we're also making it clear when you're in the queue for the coffee or the takeaway or the click and collect, even if you're in a outdoor environment, you need to wear a mask because someone may come in closer proximity at that time. We're also asking, and this is a recommendation that won't be in the health orders, but my strong recommendation is when you're walking and exercising with someone from your household, similarly wear a mask outdoors. We don't see the need within family groups, but the issue is that sometimes people again come a bit too close. If you know the person, having a chat, those sort of things. We want to leave no stone unturned as we drive towards no community transmission as quickly as we can. And I just really want to extend my appreciation to the community as we go on this journey. But I also want to point out that the reason we are focused on southwestern Sydney, we have focused on Sydney overall, but we've focused on southwestern Sydney because that is where the cases are coming from. That is a cause for more intense action in southwestern Sydney, but I should also say that the risk exists across Greater Sydney, and also the regions have to be incredibly vigilant if they've had any interactions, because it is necessary for key logistics, freight and other things to move. We are a very connected society, and so it is critical that everyone follows that awareness in the regional areas as well. Thank you.
Thank you, Dr. Chan. Good morning, Premier. 162 personal infringement notices issued in the last 24 hours. That's always disappointing when I stand up here and those numbers are so high. What it means is that the millions of people right across this state that are doing absolutely the right thing are being let down by a small minority of people that continue to be irresponsible and make their own choices and decisions that put themselves at risk and their communities at risk. The Premier has made it very clear that the strengthening of the health orders will mean that people will have to change the way that they behave, particularly in southwest Sydney. In a conversation this morning with Commissioner Fuller, he made it clear that the tempo of the police response will increase. It has to increase, not just in southwest Sydney, but right across Greater Sydney and out into the regions. We understand the place that we're at with the virus, and the greater restrictions call on police to ramp up their response to ensure that people not only comply with the health orders, but public safety is our #1 priority. In southwest Sydney, in those 3 LGAs, Liverpool, Canterbury, Bankstown and Fairfield, as we speak now, a local emergency management response is being tailored to make sure that no one in those communities goes without things that they need to get through the next 14 days. A number of government agencies, our welfare and support services, our health services, our animal and ag people, and a whole range of other functional areas and government agencies attached to the Local Emergency Management Committee with local government will every single day look at issues and problems that can be fixed for people that feel vulnerable or feel that they need support in what will be a very challenging time. Commissioner Fuller is very keen to make sure that people work with New South Wales Police, that people work with those local emergency management committees to complement the health response and make sure that we can get through the next 14 days with an emphasis on public safety and helping people. Thank you.
You said that we've been treading water until now. Is that an acknowledgement that you failed to go hard enough until this point?
No, what we've done is prevent thousands and thousands of cases that would have undoubtedly emerged in the last 3 weeks. And of course, we're always hopeful that not only would we prevent the spread, stop those thousands of cases, but also quash the virus in that time. We haven't succeeded in that. And that is why, on the basis of health advice and on the data presented to us, we're taking the extra steps. And can I just make this point that I neglected to make in my opening? We appreciate the huge impact our decision regarding construction and maintenance and repairs will have on the business community. We want to make sure you have the weekend and Monday morning to secure your sites, to make sure that everything is safe whilst the pause is on until July 30. So can I please make that point, that we won't come down on you until you make sure those sites are secure, so that public safety is always maintained, as well as the safety of those sites. And I just wanted to make that point.
Why were these restrictions introduced sooner?
We always rely on the best health advice, and the best health advice had the settings in place. We've succeeded in not having thousands and thousands of cases that have existed in other parts of the world when you haven't had a lockdown. But unfortunately, we got to a point, which is why we extended the lockdown, we got to a point where those case numbers were stubbornly hanging around the exposure number of between 20 and 30 cases a day cumulatively who've been infectious in the community. The data we saw yesterday on the exposure sites show that every person in Greater Sydney is at risk. Just because you don't have a case in your local government area now, or just because you don't know of anyone who's been infectious, please know the cumulative effect of those exposure sites has dots which were released all across Greater Metropolitan Sydney. So please assume when you're stepping a foot outside your house, no matter where you live, that someone in your community has the virus. What we don't have, which is impossible to get, is as the case numbers emerge, as the cases emerge and we find people who've been infectious in the community, there's a lag of, health says, up to a week, between 5 and 7 days when we don't have the data. So the data that we're seeing and presenting to you today is really what occurred 5 to 7 days ago. That's why what we need to take is precautionary action. Had we seen data which showed those numbers going down more significantly, we wouldn't have had to put those measures in place. But our aim is to get out of this lockdown as soon as possible. That's why these measures are in place. We are already in lockdown. We're asking many people in the community to take that extra step. That's why the Treasurer and myself and the government fought so hard to get those economic safety nets in place. If you're an individual who can no longer work, you will get those emergency payments through Services Australia. If you're a business that's been impacted, you will get those grants you need to keep going. Please know that we fought really hard for that economic support package, and the New South Wales government is also putting in billions and billions of dollars of support to make sure that we can make these health decisions to keep our community safe. The quicker we get out of this, the quicker businesses can bounce back. And I have every confidence. I've seen New South Wales bounce back after the most horrific circumstances. No matter what catastrophe that's faced us in the last 2 years, and there's been enough of them, we've bounced back. This is our best chance to bounce back as quickly as we can. I have so much confidence in our people. We've done so remarkably well. Now, this latest challenge we'll get through as well. I have absolute hope and faith that this will happen.
Dr. Shunt, can I just ask, Greater Sydney has been in lockdown for 3 weeks. We've been in a harder lockdown for 1 week. It's not spreading, the science says it's not really spreading outdoors in the outside. There's very minimal cases in retail settings. Majority of the cases are linked though, and there's a big portion that aren't household contacts. So how is the virus spreading? Are people still having people over to their own homes?
So what we're seeing is some seeding of workplaces, which is driving it. So if people have to go to work, and they cannot work from home, we're seeing seeding of workplaces. And that includes workplaces that we could never close down. So we just need to accept that. And then workplaces that potentially are open to the decisions of government to close or impact on. So what we're trying to do is reduce people's opportunities for interacting with others, because once you get a workplace transmission, it's like a melting pot. Workplaces draw people from a vast geographical area, and then you get transmission to your friend that you've driven into work with or carpooled. You get transmission within the person that you sit in proximity with or interact with, often in tea rooms and social settings in those workplaces, or in the process of doing your work. And no, masks provide some protection, but no barrier is absolute. What we're trying to do is stop the opportunity for that transmission, because what happens is that next person gets infected, they then take the disease home to their household, they then trigger another set of household transmissions, and we're chasing our tail in terms of the cases. We've also trying to better understand, and can I just thank the community of southwestern Sydney. They have been superb. I think we've really working incredibly well with them, and I just want to acknowledge the work that police is putting in place in terms of the local emergent management systems to make sure that everyone's needs and health and welfare needs in that community is met.
But just so, if workplaces is the main threat at this
Well,
point,
there are
or
multiple.
one of them, then why have we kept so many of them open for all of these weeks?
So what we've seen is that the workplaces have become an issue because of the mobility of workers, and therefore I think I've been flagging that clearly we need to decrease that mobility. So the range of strategies put in today actually decrease that mobility. We're also acknowledging the work that the community's had in terms of making sure that we're not having inadvertent contact within households or links between people. So obviously we will still need some things open, but because these figures are stubbornly high, I've certainly recommended a range of the actions today to actually give us the best chance of suppressing this, as getting this down to zero as soon as we possibly can.
Dr. Chad, the number of cases that are infectious in the community, that number hasn't really budged all week. It's actually been sitting about the same point. So why not give this advice sooner? Why wait until now?
So certainly we've been flagging the fact that we needed to look at a range of whole of government strategies to decrease mobility. And we have also know that there's a lag with the data, that I suppose those are some of the factors to take in place. But I think what we've also seen this time round is that there is a need to even work. There is fatigue in the community with messaging, and I think we needed to take much stronger action, and I've recommended that to the government today.
Why is it not until Wednesday though that employers must allow employees to work from home if they can? Shouldn't that already be the case?
I'll check on that, but certainly I would foresee that employers absolutely have to do that. I think it's very clear that that is the intent of the current order. So there's nothing new about this, in the sense that we're just changing the wording to give it greater emphasis. But I think I've been repeatedly urging workplaces to do the responsible thing and allow their workers to work from home. I'll clarify that in terms of the timing. But I would absolutely say that any employer should immediately review all of the people that they've asked to come into the office immediately and ask them to work from home.
Dr. Chan, there are reports that a new mother has been separated from her newborn after testing positive at Nepean Hospital. Are you aware of that, and is there any alternative to what's obviously a very upsetting situation?
So those decisions are made not lightly, and they're made with the family unit. Some families choose to, if the person is positive, the mother is positive, then there's decisions around how they want to isolate and manage the situation. These are very clinical issues that are best dealt with and kept private, but suffice it to say, I can't imagine how difficult the circumstances of giving birth, knowing that you're COVID positive. I don't want to comment on that specific case, but I can reassure the community that the health service put in a vast array of measures to support that family at the most difficult of times.
Dr. Chan, in regards to pharmacies and chemists are continually to show up on the exposure sites. Obviously, people know the symptoms of COVID this far into the pandemic, but they are still going into the chemists, which, you know, potentially puts other people at risk. Why aren't the chemists having someone at the front checking symptoms before they let people into the store?
So look, I think we've, if you've attended the press conferences on the last few days, I've been really highlighting that, and I'm pleased to say that we've been working with the Pharmacy Guild and the Pharmacy Society to really get messaging out to chemists about the need to to organise whatever strategies that they need to keep people out with symptoms. So certainly we've been doing a lot of the public messaging and the social messaging about this issue, and I think I addressed it yesterday as well. I can't stress enough, if you have symptoms of COVID, do not go anywhere other than to a testing station. If you need urgent care, seek medical care, but ring ahead so that you're being given the correct arrangements can put. I do want to just say that do not ever be concerned about if you do have COVID symptoms seeking critical care or essential care. Our health system has got processes for dealing with that, and the last thing I would want to see is someone with chest pain or other health conditions not seeking care. It's just about taking those prudent steps to ring ahead and ask the GP or ask the doctor about the best way for you to be assessed.
Have you at any time before yesterday told the government, given them advice to do a tougher lockdown and the settings that we're seeing here and out today, or was yesterday the first time you announced?
So there's a range of updates we provide to government, but certainly I can say that we've had a comprehensive discussion today, which has informed the discussions today. But we give regular updates and raise issues of concern, and we discuss the trends in detail. And certainly today is a comprehensive set of strategies. And I think that the key issue is we need to work together. You know, the key messages we're seeing, we're reviewing the cases to look at any opportunities for preventing any infectious people in the community, reducing those exposure sites. And so some of my messaging today is really been about making sure that you don't go out to chemist shops or others when you've got symptoms. We're still finding that people are delaying getting tested. Again, that's you know, concerning for me, because it means people are potentially already infecting their household members. We've also heard some messages from the community that they don't believe that you can pass on the infection when you don't have symptoms. And so I'd just like to reinforce that you don't have to have symptoms to be able to pass on COVID. And in contrast, you're actually very infectious before you have symptoms. And so just because you and your mother are well, don't go and visit your mother unless she needs that care and compassion. if you do need to go there, make sure that you take all the precautions possible and you choose, notwithstanding this very windy day today, outdoor environments, the well-ventilated environments, try and maintain the social distancing. This all needs to be balanced against care and compassion and mental health, and I think that's some of the challenges we deal with in getting those settings right.
Premier, the new restrictions. This ring of steel that you've created around those 4 local government areas, are you not concerned that that perhaps might exacerbate that inter-family interaction that we have been seeing?
So I don't think we're talking about a ring of steel. I'll leave that matter for police. What we're wanting to do is make sure that the communities are actually really well supported. They've been doing the hard yards. It's through no fault of their own that they've been impacted by COVID. And as I've indicated, I've worked much of my working life in southwestern Sydney, and I have the deepest respect for the communities of southwestern Sydney. What I'm concerned is that we reassure the communities that their welfare, health, and other needs are absolutely the first priority. And I really acknowledge the work that the local emergency management committee will do to make sure that no one has any concerns about access to healthcare, access to testing, access to food, access to other support services. They are bearing the burden of a number of the caseloads, and hence the reason for the strategies. But this is not about them. And we also won't get out of this if we do not see that every time we move about, we could be with someone infectious. What we need to do is, if we don't interact with anyone, there is no opportunity for the virus to spread. And so therefore, as you move about, we're adjusting our mask advice to just give absolute clarity to the settings we want those masks worn in. And we're doing everything possible to mitigate any opportunities for transmission to occur.
Premier, just on the new restrictions, can teachers or childcare workers who live in Fairfield or those other outlined LGAs leave to go to work? Are they included in the exemptions?
So we're just looking at the issues that will arise, but clearly at the moment what we're saying is emergency and aged care and disability care workers. Clearly, as you're aware, we've got learn from home environments in schools. I acknowledge that this is occurring rapidly, and there may be other groups that have to for critical purposes, but I want to very much reassure the community. Healthcare staff can move, emergency services workers can move, and aged care. They will be subject to the 3 daily swabs, and if anyone's got any symptoms, do not attend work.
Premier, just on the new construction rules.
Were you satisfied with the proposal the Prime Minister presented to National Cabinet on financial support? And do you think that it's reasonable that 18 months into the pandemic, we still have to look at financial packages negotiated state by state?
Look, all I can say is speak from the perspective of New South Wales. We fought hard to get the package we did for our citizens. I'm pleased we did that. I want to thank the federal government for supporting us. But please know that over and above the amount the federal government supported us with, we're putting in extra billions of dollars to support our community. We're supporting anybody, whether or not you live in a hotspot in New South Wales. Everybody across the state is entitled to those emergency payments if you're an individual and you can't go to work anymore, or else if the business has been impacted, there's grants available to support you. For businesses, please go to Service New South Wales for the updated information. For individuals who need that, what the federal government's calling disaster payment because you can't work, please go to Services Australia. But if you are at a loss, Service New South Wales can help you 24/7 in relation to that information. But please know that safety net is there. That's why we fought so hard, because we knew that if we did ever need to take difficult decisions in relation to health issues, that we would have that economic package so that businesses and individuals don't need to stress about having that cash flow come in, that they know they can even take decisions against that money, even if it takes a few weeks for businesses to get that money come through the door. At least when they're dealing with financial institutions and others, that those institutions can be rest assured that that money's coming through the door.
Yesterday the first time that your crisis cabinet received health advice to introduce stricter measures such as these?
Yeah, certainly yesterday was the first time we received additional information about the exposure sites, the spread of the virus and the stubborn nature of those numbers not coming down. And as we've said every day, we've highlighted our concerns. I think Dr. Chant and I and the Minister have said almost every day that until we get the exposures in the community to zero, we can't open up. And they've been remaining stubbornly in their 20s. If we want to get out of this as quickly as possible, which is absolutely our intention, we need to go harder. And whilst the community is already in lockdown, this is the best time to go harder. We're already there. It means all of us have to go that extra step. We are asking a bit more of the our communities in southwestern Sydney, and I want to thank them wholeheartedly for that. I know it's small consolation when you're going through this yourself, but please know we imposed similar lockdown stay-at-home provisions to the Northern Beaches community earlier in the year. So I do know and appreciate how difficult it is. I do know and appreciate the stress it's going to cause, but please know that people from outside those areas can go in to provide those urgent things, those supply issues that those communities need. So there's no issue about getting what you need. So there's no reason for anybody to feel stressed about not having enough supplies or logistics or anything like that. People from other areas are able to deliver what they need into those communities. But if you live in those communities, you can't work outside of your local government area unless you're a health or emergency worker, as Dr. Chan has outlined, which includes disability and aged care and all those things. And even then, you do need to get what we call a surveillance test. And as Dr. Chan has highlighted, we have picked up a few cases of people who had no symptoms, but yet were tested positive through that surveillance testing. That shows you the degree of the virus circulating in the community we may not know about. That blind spot we have of 5 to 7 days, it is what's causing us alarm, which is why we've taken that extra step. What we see today in the numbers and the exposure numbers is really what took place, 5 to 7 days ago. And rather than wait to see things get worse, we're taking action now to make sure they get better. This is about quashing the virus, getting out of this lockdown as soon as we can. It's all of us working together. I can imagine if you're a tradie or a construction worker or someone working outside of those 3 local government areas, you'll say, why am I having to put up with this? It's because, firstly, the exposure sites are well throughout all of Greater Metropolitan Sydney, and we can't reliably say to you today that the person you might interact with doesn't have the virus. In fact, we'd say the opposite. Assume anybody you're interacting with, even when you're going to buy groceries or going to the pharmacist, please assume, even outside those 3 local government areas, that anybody you're interacting with has the virus.
Dr. Chan, will you make sure that it's only those designated workers who are leaving Fairfield and the
Well,
other
look, as I said, in relation to the pandemic, we're not going to have perfection, and the police have made clear, as has the government, we're not going to have what is called the ring of steel, because we trust those, not only the workers to do the right thing, but also their employers to make sure they're working around rosters, they're working around those challenges. And yes, it doesn't matter how strong the health orders are or what we say, individuals also have to take responsibility and do the right thing. Police are there to support the communities, but we also appreciate that people will exercise their common sense, because everybody wants to get out of this. None of us want to be in this situation for a day longer than we need to be. And I'm confident we'll all come together, and not only to respect the letter of the law, but also apply additional common sense to the letter of the law as well.
Dr. Chan,
Major infrastructure projects of the state, how much is that going to cost? Surely that'll be billions of dollars.
Look, there's no doubt there'll be significant cost associated with this. But the cost of not doing this would be greater, because the sooner we put in these provisions, the sooner we can get out of the lockdown. I want businesses to bounce back as soon as possible. We have the safety net there to support businesses whilst we're in lockdown. But this gives us the best chance of having businesses bounce back as quickly as possible. The cost of not doing this is actually far greater. We don't want to see a long period of time where business is out of action, quite the contrary. We want to see the shortest amount of time possible so that businesses can bounce back.
A lot of people are quite scared at the moment.
I'm sorry, I think you were next.
Yeah. A lot of people are really scared at the moment. They're not sure when this lockdown is going to end. Do you think these new restrictions will be enough to get us out of lockdown on time?
Look, there's no doubt these additional restrictions will have a great impact on us being able to quash the virus, but we may not see it for a few days. Because there's a lag in data, we might not see the impact of this for a few days. So I just ask everybody to be patient. Dr. Chant and myself and the Minister will provide as much detail as we have, but we also need the community to appreciate that the data we see is often a reflection of what happened a few days ago, 5 to 7 days ago. So we may not see the impact of these additional restrictions for a couple of days, well, 5 to 7 days at least, but we do know they will have an impact, and that's what we need.
Are there any rules on people going into those 3 LGAs for work or other reasons?
Yeah, as I mentioned, there is no restriction on people outside of those areas going into those areas to provide supplies and other things, but obviously please exercise the greatest degree of caution. If you're delivering things, don't get out of the vehicle unless you have to. Just be extra cautious when you're entering an area which has a high concentration of the virus. So there's no restriction on people needing to deliver or go into those areas to provide care or work or what have you. However, we do need to put that restriction on people living in those local government areas simply because of the numbers and the virus and the circulation. And it's pretty scary to think, which is why we've gone harder today, that we are picking up some people who don't even have any symptoms, but as Dr. Chant has said, often just before you develop the symptoms is when you're most infectious. So that's why we're sending a message also to Greater Sydney outside of those 3 local government areas. Don't assume because you don't live in southwestern Sydney or work in southwestern Sydney that you're protected. You have to be on guard because we know from the exposure sites go well throughout Greater Sydney. And we've had some near misses in regional places like the Central Coast and Wollongong and Camden and Goulburn. We've had some really near misses, and we're really fortunate that to date we've kept the virus out of the regions. We need to keep that happening, which is why we've gone the extra step today as well.
You've said no before to the singles bubbles being created, but the risk of getting COVID couldn't possibly be higher for a friend going over to visit a friend than an intimate partner.
Oh, look, we're definitely thinking about that issue and looking at what we can do, but for today's purposes, we just wanted to get the message out about no mobility, no moving around, but we are considering what it means for people who are living on their own.
Dr. Chant. Oh. Dr. Chant, just very quickly, is this the most testing time that you have faced in your role as Chief Health Officer in this pandemic? And can the state's health system cope with what we're seeing now?
I think the pandemic is one of the things that have tested us all. And I think it's tested every member of the community, and it's tested me as well. It's tested me and my team, who are really committed to achieving no community transmission as quickly as we can. I think it is in terms of the pandemic, this is a mammoth task that we have to do. But I've also been incredibly inspired by the fact that when we've asked the community to do things, they have responded in spades. And I know we're asking them to do an incredible thing at the moment. But I've always been amazed at the testing rates we never thought we could achieve. I remember when I set my target at 20,000 and I got told that was inspirational, and I'm reporting numbers now in the 80s. The health system is working very hard at the moment. It's rolling out the vaccine, it's rolling out testing, it's providing care and treatment. And so everyone is working very hard, as is other people in the community, but I just want to have a particular call out to our health staff and our pathology services at this time.